Only one out. Malibu, pretty much firing. Sheriff's on the beach. Lifeguard boat trying to get this bro. Oh, bro. Oh, sup. Is that Laird? Laird, you got it. It's painful to watch. Oh, so large. Down. Sheriff boat. This might be our first, could this be the first arrest made for surfing? Documented in history? Look at, now he's trying to bone, dude. High speed pursuit. High speed pursuit! Run! What is he trying to do? Oh man, you can't even make this up. I love this place. Yo, it's like O.J. Simpson. Look at him. It's a highway pursuit. It's a stand-up paddle pursuit. Oh my god. It's too much, dude. Look at these guys here. They got the evidence.
At home, but not everyone is obeying those orders.
He cut him off.
Yep, this paddleboarder was arrested after refusing to get out of the water in Malibu. CBS 2's Amy Johnson has more on the showdown near the sand.
It's a stand-up paddle pursuit.
A paddleboarder is chased down by law enforcement for being out on the water at Malibu Beach.
Oh, he faked him out. Now he's going back out to sea.
All LA County beaches are closed due to the coronavirus and social distancing after crowds gathered on LA beaches early in the crisis.
Sheriff boat.
The incident caught on camera as the paddleboarder was taken into custody for disobeying a lifeguard and a surfer was cited. Just up the coast in Ventura County, beaches are open and people are out enjoying them with social distancing.
I think it is safe to be at the beach.
In Ventura County, the state and county parks and the parking lots are closed, but the beaches are open if you can get to them.
Personally, I choose not to live in fear. I know it's a dangerous virus and people tend to panic, but I think if you do it what you enjoy doing, stay relatively far away from people, you're social distancing. I think being in the water and doing what you enjoy doing shouldn't be a crime.
But one scientist says the beaches are so dangerous right now, you couldn't pay her $1 million to go in the water.
Speaking of Minnesota, a doctor and state senator from Minnesota, Scott Jensen, joins us tonight on the 702 communication line to talk about an interesting piece you put in the Star Tribune recently as well. So I don't know if you like Dr. Jensen, Senator Jensen, but thank you so much for joining us tonight, sir. And let's start with this.
Good soldiers and that, but I think that people are starting to say, hold it now. We need to have a deeper understanding of this, and we're not getting it. I think that, well, in Minnesota, as a physician, I received an email last week from the Department of Health coaching me on how to fill out death certificates. And I've never really received coaching from the Vital Statistics agency in terms of how to do a death certificate. But basically, I felt like they were saying, you know, you don't have to have a confirmed laboratory test for COVID-19 in order to make the death certificate be COVID-19.
So wait. Sir, I don't mean to interrupt you, but that and what you just said, I think is critically important. Can you repeat what you just said, please?
Well, last Friday, I received a 7-page document that sort of told me that if I had an 86-year-old patient that had pneumonia but was never tested for COVID-19, but sometime after she came down with pneumonia, we learned that she had been exposed to her son who had no symptoms, but later on was identified with COVID-19, that it would be appropriate to diagnose on the death certificate COVID-19. Now, we've not done that. If someone has the pneumonia after and it's in the middle of a flu epidemic, and I don't have a test on influenza, I don't diagnose influenza on the death certificate. I will say this elderly patient died of pneumonia.
I don't mean to interrupt you, but my heart is sinking right now as you're telling me this. You're a doctor. Why in the world would they be sending you out information to fill out death certificates, whether the person's been diagnosed with COVID-19 or not, but then to say in the death certificate this person's death was caused by COVID-19? That does not sound right to me.
I went to the person in our office who does most of the death certificates over the last 10, 20 years, and I said, does this sound right? I had her look at the documents that I printed off, and she said, well, we've always been told that you always put down just facts. You don't put down any probabilities. You don't put any presumptions down. It's just what you know. And so this is concerning, and it actually gets to your point, Chris. When we start talking about the data that goes into the modeling, we have to ask ourselves a question. Are we being forthright? Are we sharing with the public? Minnesota, North Dakota, we don't need to be having it sugar-coated. We want to know what's going into your modeling.
So with that being said, why would they want to skew the number of deaths due to COVID-19?
Well, fear is a great way to control people, and I worry about that. I worry that sometimes we're so darn interested in just jazzing up the fear factor that, sometimes people's ability to think for themselves is paralyzed if they're frightened enough. And that's not where I want people to be. I want people to say, we're going to get through this. I'm going to use my head. I'm going to go to different sources. I'm going to listen to different sources. And I'm going to think for myself, because that's what America's about.
Senator, if you don't mind, after this interview, if you can send me that 7-page document, and just for clarity, you were sent a 7-page document by who again?
The Department of Health.
Department of Health, saying, hey, fill this out, whether they test positive for COVID. That is stunning, sir. So Governor Walz had his conference call today. Yeah, Doc, last question. I got about 60 seconds, sir. We'd love to have you back, but I actually originally brought you on because I thought you had a fascinating piece in the Star Tribune. If we can bring this up, Christy, but it says, hey, more thoughtful lockdown rules could spare loss and suffering. It was really geared towards, look, guys, we've got to obviously put public health first, but also be concerned about our economy. 30 seconds, sir. Why should people go read this piece?
Well, I think what it does is it says, listen, we're not going to have government make arbitrary decisions about what is an essential and a non-essential business. We're talking about measuring what we're trying to do. We're trying to provide some separation. We're trying to provide some social distancing. And if that's the case, we need to look at what's a safe occupation and what's not. So if two people are mowing a lawn on a golf course and they're 30 yards apart, that's not an issue. If we've got lawn people and they're working in solo or two-man crews, this is not an issue. When government goes overboard, we lose our liberties and we may never get them back. So we need to be very careful. We can do it with a more laser precision rather than just whack-a-mole.
Doctor and Minnesota State Senator Scott Jensen, thank you so much for the time. And boy, I think you made some major breaking news today, sir. And if you would, again, please email me that document, okay?
I will do that.
Thank you very much.
If someone dies with COVID-19, we are counting that as a COVID-19 death.
No, I can't imagine if someone comes in with coronavirus, goes to an ICU, and they have an underlying heart condition and they die, they're going to say cause of death, heart attack. I cannot see that happening.
That was from yesterday's White House briefing, and it sparked a nationwide debate over how we count deaths from COVID-19. Do we count someone who tests positive for the virus but died of pneumonia as a COVID death? But what about someone who dies with symptoms of the disease but was actually never tested? It's actually crucial information. COVID death stats inform the models that guide federal and state governments' responses to the crisis. It's really important. Now, Italy, very interesting, has been grappling with this same debate for weeks. I mentioned it 2 weeks ago. I'll mention it again. Here's what the Daily Telegraph reported. According to Professor Walter Ricciardi, is the scientific advisor to Italy's Minister of Health, this is what he said. He said, the way in which we code deaths in our country is very generous in the sense that all people who die in hospitals with the coronavirus are deemed to be dying of the coronavirus. On re-evaluation by the National Institute of Health, only 12% of death certificates have shown a direct causality from coronavirus, while 88% of patients who have died have at least one pre-morbidity. Many had 2 or 3. My next guest is a doctor and state senator in Minnesota who is deeply troubled by the CDC's latest guidance for counting COVID deaths. Dr. Scott Jensen joins me now. Doctor, I want to read for our viewers what the CDC says in part about how to count COVID deaths relating to that last issue we just raised. In cases where a definite diagnosis of COVID cannot be made, but is suspected or likely, like the circumstances are compelling with a reasonable degree of certainty, it is acceptable to report COVID-19 on a death certificate as probable or presumed. So, doctor, what's the problem with that?
Well, in short, it's ridiculous. I spent some time earlier today just going through the CDC's manual on how to complete death certificates and the parts that were specifically written for physicians. And in that manual, it talks of precision and specificity, and that's what we were trained with. The determination of the cause of death is a big deal. It has impact on estate planning. It has impact on future generations. And the idea that we're going to allow people to massage and sort of game the numbers is a real issue, because we're going to undermine the trust. And right now, as we see politicians doing things that aren't necessarily motivated on fact and science, the public's their trust in politicians is already wearing thin.
And doctor, in that same CDC guidance sheet on COVID-19, it references the fact that basically this is a judgment call for doctors on how to fit, I read it, what goes on line 1 and then what goes on line 2 and what goes on the final line as far as contributing factors and ultimate cause of death. But they concede that it is a judgment call. Again, why is that not correct?
Well, let's just take influenza. If I have a patient died a month ago, had fever, cough, and died after 3 days, and maybe had been an elderly, fragile individual, and there happened to be an influenza epidemic around our community, I wouldn't put influenza on the death certificate, and I've never been encouraged to do so. I would put probably respiratory arrest would be the top line, and the underlying cause of disease would be pneumonia, and in the contributing factors, I might well put emphysema or congestive heart failure. But I would never put influenza down as the underlying cause of death, and yet that's what we're being asked to do here.
Dr. Fauci was asked about the COVID death count today. Here's what he said in part.
What do you say to those folks who are making the claim without really any evidence that these deaths are being padded, that the number of COVID-19 deaths are being padded?
You will always have conspiracy theories when you have very challenging public health crises. They are nothing but distractions.
Conspiracy theories, doctor? So you're engaging in conspiracy theories. What do you say to Dr. Fauci tonight?
Well, I would remind him that anytime healthcare intersects with dollars, it gets awkward. Right now, Medicare has determined that if you have a COVID-19 admission to the hospital, you'll get paid $13,000. If that COVID-19 patient goes on a ventilator, you get $39,000, 3 times as much. Nobody can tell me after 35 years in the world of medicine that sometimes those kinds of things impact on what we do. Some physicians really have a bent towards public health, and they will put down influenza or whatever because that's their preference. I try to stay very specific, very precise. If I know I've got pneumonia, that's what's going on the death certificate. I'm not going to add stuff just because it's convenient. I think that it's not a conspiracy theory at all.
Yeah. So you reject what he said?
Absolutely.
Well, it's interesting that in Italy, where it's socialized medicine, I guess they don't have an interest in the money, if that's what it is here, and they just went back and they started reclassifying deaths according to their top scientific advisor. So they admitted that they were being liberal or generous in how they coded some of these deaths, and they're just going back and reclassifying them. Does that surprise you?
It really does. I mean, let's just take someone getting hit by a bus and they collapse along and they go into the emergency room and they're there for 15, 20 minutes. Blood work comes back, COVID test comes back positive, and they die 20 minutes later because of their collapsed lung. We're going to put that down as COVID-19? That doesn't make any sense.
Dr. Jensen, really important conversation. We really, really appreciate your data-driven perspective. Thank you so much.
Hey friends, Sean from SGT Report here. Before we begin with my friend Corey from Corey's Digs, just a few quick news items. As many of you already know, Dr. Fauci has an extreme conflict of interest and knows Bill Gates a whole lot better than maybe any of us had previously thought. Listen to this clip from Patrick Henry on his channel Diverging Perspective.
the Leadership Council, this is the Leadership Council of the Bill and Melinda Gates Foundation, is comprised of several people, including Dr. Anthony S. Fauci, Director of NIAID, part of the National Institute of Health. He sits on the Leadership Council board of the Bill and Melinda Gates Foundation. And folks, that is a conflict of interest. If your best friend and bud that you sit on his leadership council of his foundation is Bill Gates, and you are a very crucial key player in the coronavirus task force, in fact the one that gives recommendations, and I mean this guy's been calling for national lockdown and all sort of crazy stuff, so at the very least I find this a conflict of interest. Fauci should, in all rightfulness, step down immediately. No one should have to fire Fauci because of this conflict of interest. He should, of his own accord, step down immediately.
By the way, friends, in another tweet, I shared this picture of people like Bill Gates Sr., David Rockefeller, Ted Turner, an avowed eugenicist, George Soros, and look, Dr. Anthony Fauci. You'll hear us cover some more of this in the interview you're about to hear. But suffice to say, friends, people are waking up in droves and understand that public enemy number one at this point are people like George Soros and Bill Gates, not the coronavirus. On April 6th, I tweeted, "If you despise this man, give this a like." And it got 12,700 likes, much more interest than anything I've ever tweeted before. Bill Gates is clearly an enemy of humanity and our freedom. Friends, before we begin this interview with Corey, just a quick word from our sponsor. With practically everyone working from home now, VPN security is required.
これから学校では教えてくれないことを爆音で伝えていく。可能な限りボリュームを上げて聞いてほしい。耳から入った音が体を通って魂まで揺さぶるほどの音楽の力を最大限に引き上げる。目には見えない力を発動する。俺たちの言葉や歌、音を通してお前の魂がお前自身に語りかけるから、自分を信じて聞いてくれ。信じ抜いた先に行くべき未来、たどり着くべき場所がある。たとえ一人でいたとしても、みんなと一緒にいる気持ちにまでさせてくれる。これは何なのか。こんな一体感を